This patient was referred to me for endodontic retreatment of tooth number 31. Patient had pain and there was a buccal particles associated with the tooth that I will show you in a few minutes. As you can see, porcelain crown, prefab metal post, useless. That's a useless post, other than perhaps causing a vertical root fracture, splitting the tooth. And you can see previous root canal and a large periapical lucency here. This root canal, according to the patient, was done by an endodontist a few years ago. Recently, tooth started to hurt. Then he noticed a swelling and went and saw his dentist, and his dentist referred him to us. So, tooth was tendered to percussion and palpation, probings 2 to 3 millimeters all around. Let me show you the buccal particles. So this is the tooth. And as you can see right here is the particles, and you can see the sinus tract right there. Is another angulation of the pre-op radiograph. Again, you can see the periapical lucency here. You can see the short fill here. Short fill doesn't matter. This endodontist could have filled to here, as long as there was no periapical lucency. The reason for the periapical lucency is bacteria inside of the canals. Okay, so I want you to pay attention to the mesiobuccal canal here. See it in this angulation here. So it looks like the mesiobuccal joins the mesiolingual, but it was blocked. I removed the gutta-percha here, tried my best. It just would not open. But I was able to regain patency in all the canals. So you can see again, the short fill, but looks like the mesiobuccal joins the mesiolingual canal. So I was able to regain patency here. So went through the porcelain crown, removed the post. I used ultrasonic, and I just touched the ultrasonic to it, and it just popped right out. It's not even inside of the canal. It was placed in the distal lingual canal. All right, so let me show you. I use chloroform to remove the gutta-percha, and then I use C files to be able to regain patency. I bent all my C files to try to regain patency in the mesiobuccal canal, but it just couldn't do it. It was completely blocked, but it looks like, as you can see, the mesiobuccal and mesiolingual canals join. This was the actual post that I removed. Here's the post-op. As you can see, everything went beautifully. Take a look here. Look at that nice lateral right there. Look at all of that anatomy right there. Beautiful S curvature in the apical area of the mesiolingual canal. This is another angulation, and you can see the mesiobuccal canal. This was as far as I could go. But as I said, it looks like the mesiobuccal joins the mesiolingual canal. And look at all of this anatomy here. Look at all of this anatomy here. Look at all of this anatomy here. Another angulation. So much anatomy here. And again, you can see everything went beautifully. All right, so we went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. In these situations, always tell the patient before we start, during the consultation appointment, I go over of course, the guarded prognosis and everything with the patient. And then during treatment, I'm communicating with the patient and telling the patient what I'm doing and what's going on. So, for example, here in this case, I told the patient don't get a new crown yet. I don't want you to spend any more money on this tooth. Just have your dentist replace my temporary filling with a permanent filling and wait for a new crown. Come back and see me in 6 months. In 6 months, if we see the periapical lucency has healed or partially healed and the buccal swelling is gone, of course, the buccal swelling should go away within a couple of weeks. But the goal is to regenerate, have his body regenerate bone here. So I told the patient, then in 6 months, if this is gone or reduced in size, then you can go ahead and get a new crown, because in 6 months I may just tell you to extract the tooth if this endodontic retreatment is deemed unsuccessful. And the patient agreed. So as you can see, again, everything went beautifully. I'm optimistic about this tooth. We'll see. Only time will tell. We do our best. That's all we can do.